Hello, everyone. It's Monday, May the 3rd. Over the weekend, we lost 7 additional people. Really and truly, I guess if I were to be perfectly honest with you, every day that it comes in single digits, and 7 is 7 way too many, but 7 is a lot better than where we've been. You got to be cautious though about a weekend number, because sometimes you don't get everything reported over the weekends, and so, but these 7, I ask over and over that please keep them in your prayers. Please don't let these people, these great people, die in vain, and please don't let their loved ones feel alone. The 2,680th death is a 73-year-old female from Pocahontas County. The 2,681st death, a 93-year-old male from Jackson County. The 2,682nd death is a 70-year-old male from Lincoln County. The 2,683rd death is a 76-year-old female from Nicholas County. The 2,684th death is a 77-year-old male from Logan County. The 2,685th death is a 63-year-old female from Marion County. And the 2,686th death in West Virginia is a 67-year-old female from Brooke County. Again, the youngest of all these folks is a 63-year-old. We also have a 67-year-old, all the way up to a 93-year-old. How much wisdom? I keep talking about wisdom, but how much wisdom have we lost here? Now, I'm going to go into a whole lot of stuff and everything, just a few moments and everything. Again, just asking and pleading with you to listen to me. But before I go there, let me tell you just this too. You know, we lost another young person in West Virginia, a basketball player. We lost a basketball player a week or so ago at Capitol High. Now we've lost another basketball player that's at Woodrow Wilson. That team's in the state tournament right now. And we lost a kid, I guess, just over the weekend. You know, this has grown to be something that we almost accept and just go on about. All across this nation, we have gotten where, you know, mass shootings or just young people being taken from us for whatever the reasons may be, and I do not know the particulars about this situation at all, but we have got to do a lot of healing in this country. We cannot absolutely tolerate this kind of tragic events. We just can't. We're better than this. And this is so sad. So for all those folks that are at Woodrow Wilson and at Capitol, and all the folks across this land that are suffering beyond belief, please, let us, the living, help stop this some way. You know, I say it so often, but this nation has gotten to where it is, we're on a dangerous edge. And absolutely, we've got to get back to, first and foremost, not being rich and poor and black and white and union and non-union and Republican and Democrat. We've got to get back to being Americans and loving our neighbors. Absolutely, this is a tragedy, and I hate it so bad. I'm a graduate of Woodrow Wilson. My wife is a graduate of Woodrow Wilson. My son is a graduate of Woodrow Wilson. I spent most of my life growing up in Beckley, West Virginia. I hate it. I really hate it. Our numbers, we have 289 new positives. We've not tested much, you know, over the weekend. We don't have people running and get tested like we should. We have a 6.63 daily positivity number. That basically tells us we didn't have many people test. Our cumulative positive continues to fall. It's at 5.15, and cumulative, I mean all added together. Our active cases are 7,201. I wish we could get that under 7,200, then under 7,000. I wish we could get it to nothing. Our recovered cases, 144,310. Our hospitalizations are 224. Our ICU units are 84. And now we have 3 red counties, Berkeley, Raleigh, and Wirt. And I go back to just this. Do we realize what is it going to take for us to get this? Do we realize that the average age of people that are testing positive right as we speak for COVID has dropped from 44 to 34. Now, to get an average of 34, you've got to have a pile of people that are 16 to 25 years of age to average at 34. So in all of that, I keep reminding, just this. And just stay with me just one second. When are our young people going to realize, and when are our older people going to realize just this? That you are in contact with our younger folks, and you may be vaccinated right now. Do you not think you have a responsibility to absolutely call your family together and say, now look, you got to go get vaccinated. You may not be concerned about getting sick. You may not even get sick, but you got to go get vaccinated. The reason you have to go get vaccinated is you've got to go get vaccinated to protect me. And I'm speaking of you. You've got to go get vaccinated to protect yourself. And you've got to go get vaccinated to protect your neighbor. Now, some way, somehow, our younger people have got to really step up. And that's better. It's way better. On the announcement of the savings bond and the $100 to them and everything, we all knew that it's not a silver bullet, but it's better. It's substantially better. And now we have, I think I was just told, over 110,000 of our 16 to 35-year-olds that have been vaccinated. A bunch of those were prior to when we just started ramping up in this new marketing campaign. But now I am telling you, I am absolutely pleading with you again. If you're 65, if you're 75, now just think about this. I told you a week or so ago of a great friend of mine who had both vaccinations, and was fully vaccinated, and boom, ends up with COVID. Now, it can happen. Very, very rare, but it can happen. Now, and we do not know about all the variants that are out there. But we all know, and I don't know how many times I would have to say just exactly this, all the medical experts, every single person we can draw on tells us without any question that if we were all vaccinated, this danger will go away. If we get to a level of vaccination, like 70% of our total population, this terrible killer for all practical purposes fades away. Now we know that. And yet, we still have people that are struggling to go and step up. Now just think with me just one second, and I don't mean to be on a soapbox here, but I've got to just tell you this. Do you realize that we almost had 100% counted when we did our census? Well, now just think about it. What in the world could possibly be more important than being vaccinated? What could be more important? Is it more important that we got counted, or is it more important that we get vaccinated? You know, what could possibly be more important? Now just think about this, and this is kind of a, pet peeve of mine to say that, but I want this state to grow. I want this state to grow population. I want to bring us more and more great opportunities to this state. Do you realize that we work so hard to get counted in the census, and what if we had not done that? Do you realize that after doing all of that and being counted 100%, West Virginia still came in, as far as population growth, dead last? Dead last. And not only dead last because of population growth, but significantly dead last. Way more dead last than the people that were in 49th place. Now, what does that tell us? What does it tell us? It tells us that you best better in West Virginia, you best better be doing stuff that absolutely drives population to us. I absolutely have an incredible plan on our personal income tax. It was a way for every West Virginia wage earner to stay cash positive, to stay with more dollars in your pocket than you have today. It was a way, absolutely, to bring population growth here, and in my opinion, it would have brought incredible population growth. All you got to do is just look at the remote worker program and how much response we had to that, and that will tell you just a tip of the iceberg of what it would have done on population growth. So in other words, you'd had more money in your pocket, we'd had more population growth happening in West Virginia, and all of our small businesses, our restaurants, the dress store, Walmart, wherever it may be, all of those folks would have absolutely captured an incredible amount of business, because we would have had an additional $1 billion in the hands of our people. It was an incredible misjudgment by our legislature. Our Senate stepped up, but our House didn't. And literally, absolutely, then after that now comes out that West Virginia is substantially dead last in population growth. Only, I think, 3 states had negative population growth. Now, I could be wrong about that. Do you realize that if we had not counted as we did in the census, we're going to lose another congresswoman or congressman position? We're going to lose another seat in the House, and we're going to go down to 2 in West Virginia. Do you realize if we had not pushed and done the level that we did, my goodness gracious, they may have taken all of our seats and declared West Virginia as a state park. And I'm only exaggerating to make my point. We have got to be wise as we govern here as legislators, as I govern here. We absolutely have got a critical economic issue in West Virginia, in that we are losing our population, and it holds back roads, it holds back schools, it holds back every aspect of our businesses in this state. It was a terrible miss. Now let me just transition away from that and just say just this. If we don't get our population vaccinated to the highest level possible, we're going to have a bunch more people die. Now, if you can stand that, fine. I can't. I can't stand it. If you can stand seeing one of your loved ones die, fine. I can't stand that. Now, I'm going to report to you some good numbers here, and I'm going to report to you just the fact that we absolutely can do it. Now, just think about this just a second. Hold tight with me. In the state of West Virginia today, we have 53.5% of the people have had one dose. These are eligible people, 16 and above. 44% of the people that have had that one dose have had, we have 44% of the population has had both doses. That's incredibly good. Incredibly good. Our nation is trending somewhere a little above a third of the population. Let's say it's 35, 37%. We're at 44 that's been fully vaccinated. All that's great. By getting that way out ahead of the game with our elderly, 65 and above, we have 79.3% 65 and above that have had at least one dose. And you know they'll get both their doses. But we're trending to an 85% level. It's amazing, amazing. It is absolutely fantastic, and we've saved all kinds of lives there. Now, I know we can do it. I know in West Virginia we can do this. So with all that being said, I've just got to go back to what I did in the census and ask again for your help. If we are able to obtain these numbers, absolutely this dreaded disease will go away in West Virginia, or it will be so minimal that absolutely we may not have to be here every day. And I am honored to be here in every way, but with that, I hate like crazy being here and reading all the names of folks we lost. So, if we can do it, we proved how we can do it in the census. We know how important it is. And I can just tell all of y'all, all the people that are out there, 50 years of age and older, again now, even though you've stepped up and you're fully vaccinated, there is no guarantees. There is no guarantees in life. But we know without any doubt that if we can get to the kids and get them vaccinated, it may very well save your life. So please help me. Please help me. Tell our younger people that they have an obligation. They have an obligation to step up. I'm trying to reward them with the savings bond and all that, and that's just really a gimmick to try to motivate them to go. Because I'm trying to protect you. I'm trying to protect them. I know by our medical team what incredible transmitters they are of this, and I know how dangerous it is. All you got to do is turn the TV on. Look at the situation that's going on right now in India. Do you realize that 403,000 people in India, they ended up with 403,000 in a day new cases? This thing's a long ways from being over. I can't stand these masks. I want rid of them. I was able to watch the Kentucky Derby and saw something there that was really good. A lot of people back out and doing something. And that's what we want. And I can assure you that that's what we'll have. But all we have to have now is people step up and take the vaccine. Just a second ago, when I asked you to call your family together, I didn't mean for you to call them together and be right up in their face. You can bring them together by phone or whatever it may be. But please help me get them vaccinated. Please help me get them vaccinated. Now, I'm going to go back and I'm going to go quickly as I possibly can. And just let me get back to where I was there. Okay. I asked you, I gave you the promise on Friday. I'm going to have to read this to you, that we would be making some vaccine operational changes that I promised you on Friday that I'd tell you about the new ideas today. And we're going to immediately begin taking the vaccine clinics to the unvaccinated by using fixed sites and mobile sites. We will set up locations at times where there are a lot of high traffic people, like the fairs and festivals or church parking lots, sporting events, state and national and county parks, the bars, the restaurants, shopping centers and malls, community and civic groups, and the business organizations such as the Main Street programs. We're going to offer vaccines by accompanying other agencies like Meals on Wheels, the senior services, and other home health agencies. We also will engage with the hospitals, and we're already doing that, and the healthcare facilities to vaccinate patients on discharge, move messaging through primary care providers, open up vaccine availability to doctors' offices and practices, encourage physicians and medical professionals to engage with their local community clubs and organizations to push vaccine messaging. We're also going to focus on a new communication strategies, and we're working on that all the time to be able to really target our younger people, through social media or streaming services. We're also going to reach out to the local EMS agencies to enhance vaccination opportunities. And it may even come down to this, that we're going door to door. And if we have to go door to door, we'll go from door to door, on community-based outreach as well. Finally, we're going to encourage our local businesses to offer discounts if they would. We'll absolutely get that out for anybody that's vaccinated or other incentives they can come up with. It's a crying shame if you really think about it, that we've got to do any and everything to be able to get our people finally across the top of the mountain. And I can understand, I'm respectful, and I can understand these fears of the boogeyman that people put in people's minds. But really and truly, we know these vaccines are incredibly safe, and we know the exposure, the absolute exposure to what can happen and is happening all over this land. We got to get on our toes here. Our vaccine eligibility, 16 and above, is all up. We're targeting our young people right now, but we're absolutely giving vaccines to all. I've gone through, our vaccine distribution update. We're at 83.9%. We want that to always be at 100. We're doing great on first and second doses together, but we have hit a wall as far as being able to get a lot more shots in arms of our people that haven't had their first dose. Now, as far as our young people, I congratulate them. They are stepping up. We have had thousands of them that have stepped up and everything, but we need lots and lots more. So please take it as an obligation. Please take it as a life that you're protecting in yourself, but many lives that you're looking at the potential of saving. The manufacturing and church outreach, as far as going to businesses or going to churches, we'll go anywhere. All you need to do is call us, and we'll set it up immediately. From the standpoint of our vaccine info line, it's up. The vaccine reminders about what I've said over and over. Please quit worrying about the boogeyman or growing antlers or whatever it may be. It is silly. It's silly to think about that compared to the risk you're taking by not taking the vaccine. Our testing is down. We need to get our testing going and ramped up in a bigger way and everything. If you're feeling the least bit bad and you're 65 years of age and older, you've got to run and get a test. You have to. And we'll shut it down with the antibodies if we find you positive. We can catch it early enough. The drive-through pharmacy, we again thank Fruth and Walgreens. From the standpoint of our long-term care outbreaks, we've got 16 at our long-term care facilities. That's up. We have 8 at our churches in 7 counties. That's Berkeley, Grant, Greenbrier, Hardy, Jackson, Nicholas, and Ritchie counties. That's up a little bit. I tell our church community over and over what a job they've done, what a job at our long-term care facilities have been done. This is not over. You have got to stay on your toes. Please stay on your toes here, and please continue to help us. From a corrections update, we have 26 inmate cases and 5 staff. They are doing a wonderful job there. They always have. Our face coverings, I've told you about that. I ask you over and over to give blood. From a standpoint of our state park vaccinations, our state parks, as part of our ongoing efforts to get more West Virginians vaccinated, we are going to hold free vaccination clinics at all West Virginia state parks between now and Memorial Day. Before Memorial Day, we are going to start with several high-traffic parks, and we'll add more as needed. On Memorial Day weekend, all West Virginia state parks will offer vaccines to employees, families, and park guests. Clinics will be set up at central park locations, all on the outdoors, and all details will be posted on the www.stateparks.com. Okay, just a couple more things real quick. This is a really important one to all of our essential workers, but it is critically important that all our essential workers continue to be supported in every way as they work to combat COVID-19. This is all about the extension of our child care subsidy extension program. On Friday, I extended the child care subsidy assistance for all essential workers of any income level. This act of financial support enables our essential workers to know that we value their work and give them continued assurance of the safety and care provided to their children through the West Virginians child care system. So thank you all for all you've done and all you continue to do in every way. We're going to stand steadfast behind you and in trying to help you in every way we can. I'm very, very proud to be able to have extended that and everything. And now the last thing that I have is just this. Our revenue numbers came in, another surplus. Revenue wasn't quite as high as what we thought, but it came in at 1.9 million. We'll take any number that's in the black and everything. Now our year-to-date surplus in West Virginia is $237,300,000. If you just think about it, $237 million surplus now in West Virginia. That's wonderful, wonderful news. And so congratulations to all those that put in the licks to make that happen every day in West Virginia, especially our businesses and our folks all across this great state. But I really, really want to send out special thanks to our Secretary of Revenue, and that's Dave Hardy and all of his people that work right with him, Mark and Mike and all those. We really appreciate all your efforts and everything. And so keep doing it, guys. And last thing I'd say is just this, I just got this earlier, but here's a Metro News article about this kid right here that we lost last night or over the weekend, and daggone, we gotta really push the reset button in this country in a lot of ways. We're so good. This country is so good, and we're so blessed, absolutely so blessed from God above. We need to get back to doing what I said, loving each other and loving your neighbor. So nevertheless, that's all I've got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. The governor was very explicit and very clear about his call to all of us in West Virginia. And I want to address our younger West Virginia residents. There are many, many reasons why choosing to be vaccinated is valuable for you. We know that if you're fully vaccinated, you are protected against getting COVID and getting significant side effects from COVID. We know that you don't have to quarantine if you come into contact with somebody within 6 feet for greater than 15 minutes. You don't have to quarantine as you do if you don't have the vaccine. We also know that you can live a regular life if you have the vaccine. And as we look at West Virginia today, we see, as the governor said, that we are now experiencing a more rapid growth of the United Kingdom variant. In the past 4 days, we've gone from 654 reported cases to now 930 cases of the United Kingdom variant. We also know that the vaccines that we give are remarkably effective at reducing severe infection, hospitalization and or death from any of the variants, as well as the native COVID virus. We know that in West Virginia, that 150,000 people have been infected with COVID-19 and 2,686 great West Virginia residents have died of this infection. And we know that about 650,000 West Virginians have been fully vaccinated. And to date, we've only been able to define that 3 people died of COVID-19 despite having full vaccination. That is such an extraordinary decrease. We see the same thing happen in the US, where we see in 32 million cases of COVID-19, we've experienced around 580,000 deaths from the disease. And we see that fully vaccinated Americans now, which is over 100 million Americans fully vaccinated, that we've seen that risk of dying from the infection go down to only 74. These vaccines are incredibly effective. They're incredibly safe. Everybody in all of our families who's here on the press brief has had full vaccines. We also know that the likelihood is these vaccines will also protect people against the problems of long COVID, long-term side effects of being infected with COVID, which can range from 10 to 50% of people who get infected, depending on which study you look at. As the governor said, when we look at countries that don't have vaccines, they are suffering unbelievable problems. The country of India is seeing over 1 million new cases every 2.5 days. And they're seeing so many people that are dying of COVID-19 that they don't have enough space in crematoriums to be able to keep up with the number of deaths to cremate the bodies, as is appropriate for at least some of the religious followings there in India. And that's because they only have about 2% of their population vaccinated. So we are very much making a plea to all West Virginians. We're seeing the variant virus start to increase in the number of people that are being infected. When we look at our 7-day averages, most of the spread is in our 10 to 19-year-old part of our population, and most of the spread of the variants is in the 10 to 29-year-old part of our population. So it's really important, for all the reasons I stated, that you choose to be vaccinated, to live a regular life. The power is in each one of our hands to protect ourselves and protect each other. And as West Virginians, I know that we will always do the right thing to serve each other. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just again like to highlight some of the things that the governor talked about after we met with him over 2 weeks ago to energize additional strategies. We are having great success with partnerships with the State Department of Education. And as he mentioned, we'll get into another phase of vaccines in schools, particularly as we open up the 12 to 15-year-olds, hopefully in the very near future. Great support with SSAC and working with our young athletes, our colleges. But we have to continue this effort, as both the governor and Dr. Marsh have pointed out. And I just go back to personal standpoint of hearing the stories when my grandparents grew up and dealing with the challenges of World War II. That generation stepped up and they put aside differences and challenges, and they took on individual responsibility to protect our nation. We need to do the same thing with vaccines. If you have concerns and you still have concerns about health risks or whatever it may be, call our hotline. We will link you up with a medical professional who can walk you through those concerns. Let us know where we can go and deliver vaccines. If you're a group, you're a business, we're having over the weekend, we had a number of businesses and organizations call us to set up vaccine clinics. We've got to step up and do this. We have gone from managing sparse availability of vaccines and getting them into the correct arms to managing vaccine supplies to make sure that vaccines don't expire and we use them in time. So please step up, get vaccinated. Let's get back to normal. Thank you.
Thank you, sir. Next to Secretary Bill Crouch with the DHHR.
Hello, everyone. Excuse me. Vaccinated staff at nursing homes and assisted living facilities are no longer required to be tested twice a week. We have a new executive order filed late Friday for nursing homes and assisted living. However, unvaccinated staff must continue to be tested at least twice a week. So vaccinated staff must still follow the recommendations of Centers of Medicare and Medicaid, CMS. Facilities can be assessed penalties for non-compliance. Fully vaccinated refers to an individual who is more than 2 weeks following receipt of the second dose in a 2-dose series, or more than 2 weeks following receipt of the single dose or Johnson & Johnson vaccine. Unvaccinated individuals refer to persons who do not fit the definition of fully vaccinated, including people whose vaccination status is not known for the purposes of guidance. Testing guidance has not changed for symptomatic individuals. Regardless of vaccination status, residents, staff showing signs and symptoms of COVID-19 must be tested immediately. One other issue, patient registration for medical cannabis cards open to individuals. I'm sorry. The West Virginia Office of Medical Cannabis encourages individuals eligible West Virginians with serious medical conditions to register for a medical cannabis patient card at www.medcanwv.org. Let me say that one more time, www.medcanwv.org. A list of physicians registered to certify patients as eligible for use of medical cannabis is also available on the website. Though the registered physicians will certify the patient is eligible, the patient must apply for an identification card on the website. Physicians interested in obtaining authorization to certify medical cannabis must complete an approved 4-hour course along with registration application. There are many West Virginians who are experiencing chronic pain due to a serious medical condition. Registering for a medical cannabis card through the web portal will ensure these patients will have access to medical cannabis at the time the products are available. Patient cards are valid only in West Virginia. Registration does not mean medical cannabis products can be immediately obtained. We're waiting on the growers and the processors to finish building out the system. We're hoping that can happen by end of summer at this point or early in the fall. Thank you.
Thank you, Secretary. Dr. Aina Amjad, our state health officer, had a prior engagement today, and she will rejoin us on Wednesday. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. I'm hearing a lot of ideas, and you've mentioned them both last week and today in regards to how to reach particularly the young people. And those are many of which are, maybe good, maybe bad ideas. But are we going to see like an actual plan, like a plan we can hold in our hands that has been vetted and all of this to determine how you're going to go forward and do this? And particularly in regards to the savings bonds, I get the impression hearing you all talk about that's something you want to do, but it doesn't sound, you also sound like perhaps that's not something you can do. So where do we stand on that? Are we going to be able to do savings bonds? Are we going to do checks instead? What's the status of all of that? Thank you.
Well, Stephen, let me answer. I want to do the savings bonds, but in growing up as a kid, savings bonds were given to lots of the children and everything for birthdays or graduation or whatever it may be. Now that process is not what it was at one time. And so that's causing us an issue. Now, we've been with the Treasury Department over and over and over trying to figure a way to do all this. I want it to have some level of patriotic flavor to it, but nevertheless, if it comes right down to this, I mean, we'll do it this way. I mean, if it comes down to a card that you swipe and the card itself is something that you can keep, that has a real patriotic type flavor to it that you can keep, great. If we do that, and maybe we can add with it a silver dollar, you know, but I'm wanting some way to have something that our kids can keep, and along with them absolutely having the money. Now, the great part about the card is just this, where it's a little bit, maybe not that way with the bond, but then that money would go right back into our economic system almost immediately and everything, and that's really good too. And so we're trying to figure it out, you know, just the simple act of trying to come up with 200,000 plus silver dollars is very, very difficult to do. And so my people haven't figured that out exactly yet and everything, but and as far as working, you know, with the, you know, all the education people and everything, to be able to set up and have a program that we can lay right in your hands. We're really close, but we don't have an actual program that we can lay right in your hands right now and say we're going to be at Monongahela High School at this time, or Morgantown High School at this time, and here's exactly what we're going to do and everything. We don't have all that ironed out right yet, but everybody's working on it, and we'll have a response, you know, as soon as all the circumstances align and the stars align to where we can get everybody on the same page.
All right, thank you, Stephen. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know that it was about 2 Fridays ago we asked the federal government if it would be possible to start sending the state smaller vials or vials with actual, you know, fewer doses of vaccine in them. What is the status of that? Did we hear anything back? Is that something that's still happening? Thank you.
Well, maybe you can answer that, please, sir.
Governor, we have not at this point received anything back from CDC or FDA that would allow for that reduction in doses and number of vials, but we continue to work it and also continue to press it with support of our congressional delegation.
All right, thank you, Charles. Next to Mark Curtis with Next Star Media.
Good afternoon, or good morning, rather, Governor and staff. Governor, like you, I got out my calculator and crunched some numbers earlier. There have been 1.2 million shots given in West Virginia in the age group of 16 to 35-year-olds, about 110,000. That's only 9.5% of the people who've gotten shots in this state are in that age group. So what beyond the things you've listed today are you going to do? And again, can you get back into schools before the end of the school year? That would seem like the most likely place. And also address the issue of if you have these locations near shopping centers or malls, do the 16 to 17-year-olds have to have a written note from their parents approving permission to get the vaccine?
Okay, Mark, I'm gonna have to defer on, you know, to General Hoyer or Secretary Crouch as far as the permission slip. I was under the assumption, you know, or under the feeling that from 16 to 18 you had to have it, and so I think that's right. But I want to double check on that and everything. But Mark, you know, we're in the schools, and we absolutely know that we've got a timeline that says, you know, sometime in the next 3 weeks, or maybe even greater than that, maybe in the next 5 weeks, we're going to lose all these kids from the schools, and then it's going to even be a whole lot tougher. We got that. And so we're already in the schools, but we absolutely have got to find a way to engage and bring everybody together with this program in the education department. Now, Mark, one other thing, though, that I don't think is exactly right, but we've got, in general, maybe you can step up because I don't have the numbers right with me today, but I think, well, hold on, let me see if I do. I've got, you know, Mark, just hang with me on this. The numbers that I have is we have people in West Virginia with at least one dose, 715,000. And people that are fully vaccinated, 600,000. So now, Mark, stay with me on this. If we got 110,000 people that are 16 to 35, I don't know the percentages, but that is way more than 9% of this, what we're talking about here, I think. Now I think, but Mark, I do know this, that of that population, of 16 to 35 years of age, it's about 400,000. Well, if we've gotten 109,000 of them not fully vaccinated, but with first round shots, then that population, really, that number is really about 25% of the folks that we've gotten. Now, so I don't know if the 9% is right, because the 9% could possibly be right, but I don't see how it can be, because even if you took that 110,000 and say that those were total shots, and we've really got 55,000 of them that are fully vaccinated, then that number is more like 12.5%. But I really believe that the number is a good bit higher than 9%, but we still got a long ways to go to get that population to a level of anything that would really be substantially beneficial. And by substantially beneficial, if we could get that population to 50%, that'd be fabulous. If we could pick up another 100,000 of those folks and get them vaccinated, that would absolutely almost get us there. If we could get 50% of the 16 to 35-year-olds, we could absolutely almost get us there. Because we're going to be continuing to vaccinate other folks as well. So nevertheless, Mark, we've got a challenge to get it done before the end of the school year, and we've got an absolute challenge to have a really continual marketing program to go. And our people, you guys at the media, our people all across the state need to try to help encourage our younger folks every way you possibly can to get vaccinated, because it is so meaningful, so meaningful. So please help us.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. I'm hearing three different groups of people. There are probably more, but big groups of people that will not get vaccinated. Number one, those who don't trust government. Number two, those who haven't been to the doctor in so long that they don't really feel that they would benefit from any medicine. And the third one is people who think that the vaccine was rushed and that they don't know what the long-term effect of getting a shot will be. I would like to hear from Dr. Marsh how he would argue that case for the vaccine not being rushed, and that it will be effective and that there won't be long-term effects. Thank you.
Well, before Mark goes, or before Dr. Marsh goes, Paul, let me. Y'all know me. I'm gonna just speak the truth, and I'm just gonna be blunt. To those that are just saying we're not going to take a vaccine no matter what, and for those that have said, well, I haven't been to the doctor in a long time and I'm not going to take the vaccine, and for those that are saying, well, I don't know that this vaccine wasn't rushed and everything, what I'd say is buckle up, because a bunch of you are going to die. That's all there is to it. A bunch of you are going to die. And I can't, I don't know what the argument is. I don't know what it could possibly be. Every other day I come to you and I read a bunch of people that have died. And absolutely all the medical team in every way, all across everywhere, in every nook and cranny you could come up with says how safe this vaccine is to take. And the likelihood of death or complications from taking the vaccine is so minuscule it's off the chart. And a bunch of you are going to die. Now, and on top of that, a bunch of you, if you choose not to take the vaccine, we absolutely know, as Dr. Marsh said just a little while ago, a bunch of you are going to end up with really, really bad side effects from this because you're going to get it. You may not ever even know you have had it and everything, and you're going to end up with real problems. Dr. Marsh, take it from there, please.
Well, thank you, Paul, and thank you, Governor. Paul, to date, 1.16 billion, that's with a B, vaccines have been given. These vaccines have been worked on for over 10 years. They have undergone absolute scrutiny at the Food and Drug Administration, as we saw with, the hold of the Johnson & Johnson vaccine for a potential complication that affected 6 people out of 7 million people that have been vaccinated. So the federal agencies are incredibly, incredibly cautious. And these vaccines, as we talked about in countries like India, where we've seen 2% of their population vaccinated, they're seeing unbelievable numbers of cases. The governor talked about how many people were infected in one day. In 2.5 days, they're seeing 1 million new cases, and they're seeing so many people die. And we have seen so many people that have been given an opportunity to live because they chose to get vaccinated, that for us in the medical side and the science side, it's important to note that all of us have taken the vaccines. We've encouraged our people that we love the most in the world to take the vaccines. For me, my 90-year-old mom, my wife, my 27-year-old daughter, my 25-year-old son, my 21-year-old son, all wanted to get the vaccine, and they've all now been fully vaccinated. We would never make a recommendation to the people we love or ourselves if we didn't believe they're absolutely safe, and they're unbelievably effective. So I would just say to people that this is not only an opportunity for them to protect themselves and protect each other, to live a regular life, to be able to get back together again, but this is the way that we stop the transmission of COVID-19. And with the variants growing very rapidly in our state, in our country, and around the world, this is the way that we slow down and stop the variants. And at some point, we're all connected in this. So it's really important for West Virginia to be the leader that we have been, but then we need to move on to help other people in our country and our world also have the same access to vaccination and, like us, choose to be vaccinated.
All right, thank you, Paul. Next, we'll go to David Beard with the Dominion Post.
Hi. I've got a quick clarification before I get to my question. The clarification is for Secretary Crouch. You mentioned the applying for the medical cannabis card, and you mentioned getting certified. Do you do one before the other, or does the order matter? And then getting to my question, it actually bounces off what Dr. Marsh just said about stopping the transmission. And I wanted to ask what role being vaccinated has in curbing the spread. If I'm vaccinated, I'm immune. And the more of us who get vaccinated builds toward herd immunity. But I kind of recall that if you're vaccinated, you can still carry the virus and spread it. So can you kind of clarify that issue of stopping the transmission? Thanks.
Dr. Marsh, go.
So thank you, David. There is more and more evidence accumulating that by being fully vaccinated, which is 2 weeks after your final dose of whatever vaccine, 2 doses of Pfizer, 2 doses of Moderna, 1 dose of J&J, that you're not only immune yourself, but it's very unlikely that you will be able to spread to other people. So that's an added benefit. The other thing I just wanted to point out and add, which I didn't say so far, is the speculation is in the next week, we will see the Pfizer vaccine approved for vaccination of 12 to 16-year-olds. So that's going to be another set of opportunities for our citizens.
Yes, and David, this is Bill Crouch. It's a good question. The individual who is seeking medical cannabis must be certified by a physician, a registered physician first, and then they apply for the authorization card online. So that that information is available on the website, but you must be certified by the physician first, and then you seek the card online, and that information will be provided to you there. Thank you.
Thanks, David. Next, Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, regarding your comments earlier on the incidents of gun violence in the state, over the past 6 years, the state has either repealed or weakened a number of gun safety laws, including legislation enacted this session that you signed into law that'll prevent the enactment or enforcement of red flag laws in the state. Given the circumstances, do you think it would be reasonable to consider reinstating some sensible gun safety measures statewide?
Well, Phil, and we're probably going to, and this is no surprise, but we're probably going to be on different sides of the fence. I don't really believe that the guns are killing people. I think the people are killing people. And I have always thought that. I've always been an avid hunter, a lover of guns from the standpoint of our Second Amendment, from the standpoint of shooting and the enjoyment of all that, and target shooting and whatever it may be. But Phil, actually hunting probably introduced me to the outdoors and something that I truly believe was just a blessing from God above for me to be able to enjoy all the stuff that we do and all the stuff that is available to us with the outdoors. But I think, our programs that are out there like Jobs and Hope, all the different things that we're doing from the standpoint of anything and everything we can to combat this terrible drug situation will be helpful. But Phil, to summarize my feelings, here's just my feelings. And it's just as simple. I think our nation is divided in way too far away. I think that absolutely we are constantly bombarded with the fact of, what is a Republican idea, what is a Democrat idea. We are absolutely too far apart in every way. We should absolutely be constantly trying to embrace one another and loving our neighbors. 1 trillion billion guns, could be laid aside and not extinguished, but 1 trillion billion guns could be lying at somebody's access. And if we loved one another, we surely to goodness wouldn't be shooting each other. And so, I would be the first to say that, I strongly believe in our Second Amendment. There's people out in this world, I could argue all day long, there's people out in this world that are becoming so socialistic and so having such thoughts in America that we want our government to be in total control of us on every single thing. We don't want that in America, and so from the standpoint of our founders put in place the Second Amendment for a reason, for an absolute reason, and so no, Phil, we probably disagree on this one.
All right, thanks, Phil. Governor, I'll turn it back to you to close out.
Well, I'm gonna go back to just this, and again, When I really want you to pay really close attention, normally I ask you to do so, and I'm asking you right now to pay really close attention to what I'm getting ready to say. If you'll turn on the nightly news and you'll watch what's going on in India. Now, I know India's only received 2% of their population has been vaccinated. And I know in the U.S. we're approaching 40%. And in West Virginia, we're at 53% that have received one dose. Now, and I know India's got a long ways to go, but just turn on the TV and just look. Just watch. You know, watch them running with oxygen tanks, and they're running out of oxygen, and they're getting tanks, you know, refilled and everything else. Watch closely the people that have the respirators on. Watch and look at them, and look closely and say, well, wonder how old that person is. Because you're going to see a bunch of young people that are dying. Now, ask yourself just this next question. What if we had an unlimited amount of vaccines and we were setting in any city in India? Do you think there would be one person today in India that wouldn't line up to take the vaccines? They'd all line up as far as you could go. Because today they don't have the ability and absolutely the right to have the vaccine that we have here. And yet they would run to line up. What would they give? What would they give to have the availability of the vaccines? What would they give? They would give every single thing they have under the sun. Just think about this one. If that's not enough, think about my girls' basketball team. Now, my assistant coach is a few years older than me, not many, but he's a few years older than I am. And you know, without belaboring it, well, I just went through a birthday and everything. It wasn't real pleasant from the standpoint of the birthday, but it's great versus the alternative. My assistant coach is a few years older than me, and another assistant coach is even a couple of years older than him. We all had both our vaccines. Seven out of a team of 15 or 17 kids, 7 of them positive. 7 of them. What if we hadn't had the vaccines? What if we had not had the vaccines? 70 years old, 75, 77. It says 3 coaches. What's the likelihood that one of us would have gotten this? What's the likelihood that one of us may very well have not made it? We had the vaccines. It saved our lives, I'm sure. Now, the last thing I'd say is just this. We need our young people to step up. We need our older people to convince them that they need to step up. We need them to know that they can end up with side effects that could probably haunt them forever. And we need them to quit worrying about the dark of the closet and absolutely some boogeyman thing. You know, if they don't get the vaccine, this thing will go on and on and on and on. We need them to step up. And the last thing I'd tell you is this. It's going to be a gift, but it's going to be a problem too. If in the days to come, Pfizer comes out and says all those folks from 12 to 16 are eligible too, then we've got another problem to tackle, do we not? And on top of all that, though, it will be a gift from the standpoint that we'll get more and more and more of our total population vaccinated. Not just what we per se call eligible vaccination or eligible population. We've got some real challenges still in front of us. We've absolutely rose to all the challenges thus far. We've absolutely become that diamond in the rough, and all the nation saw us do it. Come on, West Virginia. If you don't want to just line up the body bags, come on. absolutely step up. And absolutely, I go back and I end with just this. Look at those great people in the country of India. Look into their eyes. Absolutely guess some ages of people that have masks on with oxygen in their eyes rolled back. See how many people that you see on TV, that you see a nurse or a doctor doing the compressions of CPR on somebody that looks like they're 30 years old. What would they give? What would they give to have what we have? Unlimited vaccines. What would they give? How many of them would refuse the shots? I bet almost none. We are a land of plenty, a land of opportunity, the beacon of the world. We don't need to be spoiled. We absolutely need to take these vaccines. Without any question, if you don't believe anything but one thing, think about kids that are 15 years to 18 years of age, kids that I'm with, kids that my assistant coaches are with, and 7 of them end up positive. 7 of them end up positive. What's the likelihood that myself or one of my assistant coaches, if we had been just what Paul said earlier, some people just aren't going to take it no matter what. Some people are afraid of the side effects or whatever. Some people may think they're invincible or whatever the situation that Paul said. What if myself and my 2 assistant coaches had decided we weren't going to take them, no matter what, we weren't going to do it? There's a great likelihood that all 3 of us would have ended up with this. And there's a great, great likelihood that maybe just one of the 3 of us would have died. I'm telling you, these vaccines save lives, and we need people to take them. So anyway, please help me. West Virginia, you've been so good, and I love you so much. I love you too much, to tell you the honest truth, if that's in any way possible, because I want us to stop this thing. I'll come and be with you forever and ever and ever. But I want to come and be with you and quit reading names of people that we've lost. Absolutely, I want to be with you and absolutely be back to as much normalcy as we can be. And I can't be there if you don't listen, because this will go on and on and on. It absolutely will. No matter what anybody tells you, this will not go away unless we make it go away. Because that's what I think, at least, God wants and expects us to do. You know that old thing, I told this a long time ago, about the man living right below the dam, and the dam was going to break, and absolutely the park rangers went to him and said, "You got to leave." He said, "No." Then the water started coming up, and the boat went to him, and he said, "No, I'm still not leaving." And then all of a sudden he was on the roof, and the helicopter was trying to land, screaming, "Jump on, jump on, jump on." And he never left, and he died. And then when he was going through the pearly gates of heaven, he looked right at God and said, "God, I knew you'd take care of me. Why in the world didn't you take care of me?" He says, "I tried 3 times. I sent the park ranger, I sent the boat, and I sent the helicopter. And you got to do something. You got to do something." And that's what he tells us in West Virginia right now, in my opinion at least. That's what he's telling us to do. He's given us the vaccine. He's absolutely in charge. And absolutely, he expects us to do something. I can't tell you any more frankly than that. I love you. I really love you. And I want this thing to end. Thank you so much.